So a lot of people are signing up to the NHS app. I've done some drop-ins at some of the smaller surgeries where they've struggled, and I've got some more coming up in North Walsham at some of the larger surgeries. And you notice the difference in where they've been advertised to where they haven't been advertised that they're doing it, because the uptake is big when the surgeries advertise them.
So the surgery that I was at, they often had people sort of come into the waiting room where there was a dedicated space set up for things like that. And every day there would be multiple people coming in who sort of needed help setting it up or how to do something.
There are lots of reasons people aren't online. Some of it is lack of confidence with using devices. Some of it is poverty. Broadband is the first bill to go if you're struggling with your bills. Some of it is connectivity. We have lots of areas of Norfolk where there's no mobile phone signal or it's very poor. And also being able to afford devices. Obviously, you need to be able to afford a device as well.
The people without who haven't got confidence to go on, but then haven't got a mobile phone or a tablet to bring in, so they're PC based. So you end up wanting they want it on a PC, and again they have the same worries.
But we also see a lot of young people as well who are sadly out of work at the moment, and they also don't have access to devices or knowledge, but for different reasons.
We also have different minorities as well, refugees that are coming to use services in the library and community centres to get information.
I had one lady at a drop-in session that I'd done over in Stalham, a lady that was caring for her mum. So she had access to her mum's records. There'd been some hiccups and sort of the receptionist was struggling to do it. We managed to get her on and get her set up so she was able to see all her mum's test results. I mean, she worked part-time. She was also juggling the fact that she had children. Her mum was quite poorly. So that made a huge difference for her. She didn't have to drop in prescriptions anymore. She didn't have to hold the line trying to get through to the surgery. So she was really, really pleased.
Well, I've supported a couple of people that have suffered from a stroke and have a lack of mobility and use of their hands. So there was one particular case where I've supplied an Echo Dot to ensure that they had the accessible features and they could then use the voice control around that so they could still access the services that they needed. And that was just transformative. So I think it kind of provides the independence element and just while they're recovering, it really, really helped.
Especially now we're coming into winter and going to last winter when we had the horrible wet weather and everything. People sometimes weren't able, or they had to get a taxi to go down to the chemist to hand the prescription in, or to come into the practice to bring the prescription in. They were coming in to get on the app so they could do their prescriptions online without having to go and deliver the prescription first and then go and collect it. A few set up home delivery or online delivery services as well. So we actually went as far as online delivery services with them, especially those with difficulty in moving around. It really helped them. They were really enthusiastic.
I think it can be helpful when done right. I mean, taking the NHS app for an example, it's really helpful being able to access my records, but my current surgery doesn't allow you to book on it, which is really frustrating. So having to call up and sort of deal with a queue that's sometimes sort of an hour long sort of defeats the point of having the app.
But another problem I've come across recently is when an older person had set it up, and instead of a mobile phone number, she'd put her landline on the app, and she was struggling with it. But when she was going to the GP surgery or the library looking for help, nobody could help her because nobody could log her on because the code was going to her landline at home. I'm just saying this is another problem. If somebody's put their landline in as the contact, it's really difficult for anyone else to help.
I have also seen there's been a few residents that have moved and have found it very challenging once they've moved address and changing to, a different kind of surgery, that they have found it very challenging to update the NHS app. And that's happened a few times. So I think it's just making sure that, yes, if they've managed to get onto the NHS app or they've got support from us to do that, if their circumstances change, that's where the confusion can come in.
A lot of the people don't have a form of ID, so they don't have a driving license, they don't have a passport because they've never needed one. Once you get over the device barrier, then you've got the ID barrier, and then once those are overcome, then it's a breeze, and it's a fantastic tool.
I think we need to ensure that the access is there for people, and the teaching is there behind it. But I also think that across the practices, we need consistency as well in what is accessible on the app, because I think at the moment there's a lot of difference. Someone will say to me, what can I access on the app? And I'm sort of saying, well, it's dependent surgery to surgery.
So I really think we need to be putting out more information in terms of step-by-step guides. There needs to be video tutorials that can go out to people where they can kind of give them a bit more reassurance.
Having a digital champion in every surgery for someone to speak to, for someone to, go through the NHS app for the first time, or just to be shown how to use it for the first time. In my eyes, I think that would be an ideal solution. It could be someone that's already there in the surgery that is just going to be available for those conversations. For me, that's a very simplistic way of looking at it. I know obviously it's going to be a lot more complicated than that, but they will be there as and when a service user or a patient needs it.
Whether or not you can have an afternoon once a month or a morning once a month where the surgery can have that intense sort of training with people to start off with. But once they are on there, I think it just saves the NHS so much time.
So I think it's absolutely possible and will make the world of a difference, because also being able to do stuff face to face and actually being able to see what's going on is so much easier than trying to do it over the phone.
I also see a lot of older people that have used computers in their working lives and are happily using laptops. Now they've retired, but they don't have smartphones. And it's incredibly difficult to go through the identification process on a laptop. So where I've sat with people doing that, I've actually had to, rightly or wrongly, set them up on a different device, on like a spare device I have, and then they can just log into it on their laptop, if you get what I mean. But to go through that ID process on anything other than a smartphone or tablet is just about impossible.
Speaking for someone who's worked in surgeries, there's also a lot of younger people who don't. So we had quite a few patients who were homeless who didn't have mobile phones, so that would have excluded them. Some with severe mental health problems who for various reasons didn't use technology, people with sort of learning disabilities. And I think that having digital technology can be fantastic to include a lot of people, but there are always going to be people who are excluded, and it's making sure that there is other options and that it's just not replacing what we currently have.